Hi, I'm Dr. Mitchell Josephs, and welcome to another edition of America's Best Doctors. Today we unlock the art and science of dentistry with one of the nation's top dentists, Dr. Ed Lazer from Owings Mills, Maryland. Welcome to the program, Dr. Lazer.
Thank you, Dr. Josephs.
Dr. Lazer, where did you go to dental school? And for that matter, where did you go to college, too?
Undergrad, I went to University of Pittsburgh, and then dental school, Georgetown University in Washington, D.C., and then I did a one-year residency program in Great Lakes Naval Base, Great Lakes, Chicago, North Chicago, great area.
Except for the weather.
During the winter it gets very cold, but it's a great place. I love Chicago. I was there for a year.
Great. And also, you did a lot of advanced dental education, a lot of advanced dental studies at LVI, the Las Vegas Institute of Advanced Dental Studies. Tell us a little bit about LVI.
Well, I've been started going to LVI 1998. I chose it for its all of the courses are hands-on courses, so we're working on live patients, and that's where I got my experience to work with cosmetic patients, doing veneers. That's where I got all the hands-on training. The training at dental school is good for general dentistry, but if you're doing the type of work that I'm doing in my office, I think LVI is, and the training they give you prepares me to give the quality work that I'm doing here in my office right now.
Right, and for those listening, LVI, the Las Vegas Institute of Advanced Dental Studies, it's a very elite group of dentists that attend these continuing education programs. These are the top dentists in the country that really make the extra effort to get advanced training in these highly emphasized cosmetic procedures. You do a lot of porcelain laminate veneers and cosmetic dentistry in your practice. Tell us, if you're going to do a complete smile makeover on a patient, right. Let's say the first thing that they're interested in is just lightening their teeth, their existing right. teeth. What do you offer in your practice to just lighten patients' existing teeth? Let's say finances are an issue and the first wave of treatment they want to do is just to lighten what they have.
Well, we get a lot of new patients in our office, and some of the patients come in and they just want to talk about whitening. Some patients aren't good candidates for whitening. Their color of their teeth is just stained too heavily, or it's intrinsic stain, it's inside the teeth. So some of the patients we do whitening. Some of the patients we have to tell them the whitening isn't going to work for them, and we choose to do veneers, which is it's a facing for the front of the tooth. Custom made.
Walk us through the steps. Let's say someone goes and has whitening done. What's the whitening system that you use in your practice?
We have Zoom whitening system.
Okay, so that's like a light activated whitening?
The steps that we use in our office is that we give the patients, if they want to do whitening, a week of at-home whitening first, almost like a pre-whitening procedure.
Great idea.
Then they come into the office and they sit in one of our operatories. We have direct TV. They sit back, they can watch a movie or anything they want on TV, and the Zoom whitening process is a light-activated system. And sitting there takes about 45 minutes to an hour, and it seems to work fairly well for some patients, but it is limited, as you know.
Yeah, definitely not everyone's a candidate.
Right.
I know patients that have a predominant gray coloration
yes,
as opposed to yellow.
Difficult.
It's very, very difficult to bleach.
But one thing I want to tell you is that if we do the whitening, and it isn't to their satisfaction, then the money that they have spent, we put that towards other work for them. So we don't want to say, well, you can do the whitening, it's on top of something else. But we're pretty honest, especially my assistant, she's pretty much the one who really takes care of all the whitening. She'll know if it's going to work or not.
Yeah. Okay, so let's say someone either whitens and they want to go even further, they want to do something more permanent, or let's say the whitening just didn't do what they expected.
Right.
Talk us through the process of porcelain laminate veneers. I mean, it's such a hot topic now. It's written in every fashion magazine. There's television programs about it, Extreme Makeover. Talk us through a patient's process about porcelain veneers.
I'll talk you through a typical patient that comes in. Patients will come in if they are in good dental health, if their gums are healthy and they've been going to a dentist regularly, or they're through my office, then we can start, rather quickly. We take impressions of their teeth first. We take all the appropriate x-rays, records, whatever we need. Then they come in about 2 weeks later, and we're going to prepare their teeth. And we're going to maybe shave them down a little bit. Patients don't like that word shaving down, but that's what I call preparing, about a half of a millimeter to a millimeter of the front of the tooth. And we typically do anywhere from 8 to 10 teeth. And then we'll make custom-made temporaries for the patients. So they leave with those. The temporaries are almost like a preview for the patients to see what the final veneers are going to look like. Come back a week later, we check the temporaries, see how the patients like it. If they want something changed, they have the tempers on, so they're previewing them. We can call the lab. Everything's custom made. It's not just a prefabricated set of teeth that somebody's going to wear. We really take the effort to make it the way the patient wants them to have. Then they come in that week, check the bite. Then we do some whitening of their lower teeth to try to match up the shade. We always tell the patient it isn't really going to totally match the top. It's going to be a little bit better. It's going to kind of blend in. And then they come back about 2 weeks later, and we insert the final veneers, and they're done. The whole process may be 3 to 4 weeks.
Patients are very concerned about that their teeth are going to look fake if they have cosmetic dental procedures done, like porcelain laminate veneers. They all say, oh, I'm worried my teeth are going to look like chiclets. What can you tell them that's going to appease their fear that their teeth are going to look fake, and big, square, chiclet-like teeth?
Well, we have a lot of before and after photos. Every case that I do, I take photos on. So I want to show the patients that we finish the work on, they don't look like chiclets. I mean, we look at the color, we look at the age of the patient, we look at their face. We have a whole smile library, smile catalog to try to match up the veneers with that particular patient.
And how important is the dental lab involved in this whole process? You work very closely with the porcelain lab.
Right.
What are some of the things that they could key in on to make these things look natural?
That's where the process of chiclets comes in. If you're a quality dentist and you're not using a quality dental lab, my lab has trained with me at LVI.
Great.
So that they know exactly what we're looking for. That's where the patients come in and see fake-looking teeth. Our teeth look very natural. We're happy with the way that they look. We put out different magazines, and we have a lot of patients who have testimonials for our work. A lot of before and after photos. Patients will come in the office and say, well, my doctor who I was thinking about getting it done with never showed me any pictures at all. And if there's a space closure or whitening of teeth or straightening of the teeth, I have it all. I have every photo that patients want to see.
Do you have photos of cases on your website, on your office's website?
I do have some.
What is your website for people to visit?
It's www.cosmeticdentistbaltimore.com, or you can go to www.dredlazer.com.
I'm glad you mentioned it to the audience today, because I have to tell you, I've seen Dr. Lazer's work not only on his website, but up close in person. And the work is simply stunning. It humbled me when I saw his work. It's absolutely beautiful. Okay, so concern one with patients. They're all afraid they're going to have chiclets. You totally have appeased that issue. Another concern, patients ask, well, how long are these going to last? It's a significant investment. It could be as much as buying a mid-sized Japanese car.
Right.
And they're all concerned about how long will my cosmetic dental work last, whether it's metal-free all porcelain crowns or it's porcelain veneers. What do you say to them when they ask you, how long is this going to last?
It's a good question. The biggest reason that patients don't do the work is maybe fear and cost. And we try to tell the patients, in our practice, I have a 10-year guarantee on my work. Now, there's some restraints on it that we like to do. The patient has to be seen by me or another doctor. Some patients come from other doctors, and we send them back if they're happy with their general dentist. Just every 6 months, at least, for checkups. I mean, if a patient comes in and they haven't seen anybody for 3 or 4 years, it probably isn't my fault if something is failing.
Right.
So we give them something to kind of hang their hat on, to feel comfortable with if something breaks. I've had patients come in, get into an altercation or fall, and they break a veneer. We try to help them out and say, look, don't worry about it. We're going to take care of it for you. we're here for you.
Yeah.
To help them make it through that. So 10 years is a long time. They say, well, what happens after 10 years? I'm like, you're still going to have them.
Right.
So 10 years is something for them to feel comfortable with. I think it can last longer, maybe 15, 20. Mm-hmm. So the patients feel comfortable with that.
I always mention to patients that in the dental field, when veneers were at the beginning, let's say the early 1980s, even some of those cases are still around, and the materials have improved tremendously since the 80s. So I think whatever is done now in dentistry, especially in a practice like yours, has a potential to last for a couple of decades maybe.
It does. The patient has to be diligent with themselves too. I mean, if you can't floss, especially the front teeth,
right,
then you're gonna lose them.
Yeah.
But if you're diligent,
right, but you know, when you say lose them, I explain to people that it's not that not flossing will destroy porcelain, but you will get gum disease and bone loss and gum recession, and you could possibly lose the teeth, whether there's a veneer on them or not.
Right. We have a lot of patients that want to start right away, but they need to start with their gum work first.
Right.
Getting the gums healthy, getting the bone healthy, because we don't want to put a veneer on an unhealthy tooth. Definitely. And that's one of the biggest concerns. Like, well, I want to start now. Well, that's great, but we have to start with this other part first.
Absolutely. Now, something I really need you to address, because a lot of people email me questions. Either they hear my radio program, Tooth Talk, or a column that I write for newspapers. There's a lot of advertising right now in magazines on this type of porcelain veneer called a lumineer. It's a brand name. And the advertisements say no shots, no pain, no drilling. Almost like you're coming in and having fake nails made, but instead of on your fingernails, they're going on your teeth. Well, what is up with this whole rage of this lumineers technique? What is your feeling on this?
I never do lumineers. I am not a lumineer doctor. One of the good quotes, some of the guys that I look for is when there's a no prep, no good. I don't feel comfortable. All my cases need some type of preparation. Patients come in, we do a lot of redos of the lumineer cases.
Yeah.
When if you think about it, if you're just putting a veneer, a facing over a tooth that you're really not preparing, it's going to look very bulky and very fake.
Right, because if you're not reducing the enamel at all, even if it's a millimeter or two, whatever you're adding on to that tooth is going to project outwards.
I do thousands of veneers every year. And there has been one instance where I thought of a lumineer case would even be in the realm of doing something for it.
Right.
And that's the way I practice. The cases with the lumineers are very bulky. The gum tissue doesn't seem to be very healthy. I'm sure some doctors are getting adequate results. Just in my office, it would just never fly.
No, I think you brought up some good points. I think that the companies that are advertising the lumineers, which is a company to use their lab, I think what they're not stressing is that the case selection is just paramount. You just like any surgical procedure, it's the case the surgeon is choosing to apply that technique to is very key.
I think that it's very, very misleading.
Great.